Surgical site infections. Quality Improvement Report. Our prophylactic approach to surgical site infections. This presentation is brought to you by Purdue College of Nursing. Tiana, Kayla, and Darrell. A little background. Did you know that surgical site infections are totally preventable? These infections occur within 30 days of the surgical procedure. Sadly to say, when the patient becomes infected, this can lead to detrimental outcomes if not treated properly. Patients has an increased risk of dying if they become infected. This places a burden on the healthcare system. Avoiding these infections must begin before surgery begins. This is our fishbone diagram that shows the causes and effects of surgical site infections. This is our analysis of the problem. Surgical site infections are primarily caused by the contamination of the surgical site by germs. Studies show these germs can originate from various sources, such as contaminated hands. Most surgeons are not even washing their hands properly. The bacteria responsible for surgical site infections comes from the patient's skin and also from objects causing the wound or tools used during surgery. Our action plan. Studies show that administering prophylactic antibiotics within 1 hour before surgery decreases the patient risk for surgical infections. Antibiotics must be selected based on recommendations for certain surgical procedures to reduce resistance. Correct use of antibiotics is absolutely essential to help reduce antibiotic resistance. Germs become resistant to antibiotics over time, which then makes them less effective. Our overall goal is to monitor the incidence of surgical site infections among patients receiving prophylactic antibiotics to assess the effectiveness of the medication. Remember, infection control starts with you. Make use of personal protective equipment and help prevent the spread of infections.